Good day, everybody. I'm Dr. Puneet Dhaliwal, physical therapist and assistant professor at Downstate Department of Physical Therapy, and I welcome you all to my presentation on advances in stroke rehabilitation research and implications in physical therapy. A stroke has a pretty significant effect in one's life, and as the CDC data suggests, that in the United States in 2022, 1 in 6 deaths in cardiovascular disease happened because of stroke. Every 40 seconds, someone has a stroke in the United States, and every 3 minutes and 11 seconds, someone dies of a stroke in the US. It is important to note that about 87% of the strokes are ischemic strokes, and patients who arrive at the emergency department within the first 3 hours of the symptoms actually have less disability compared to others who come late to the emergencies. As you can see, the death rates in New York City is pretty predominant in certain segments of Brooklyn, Bronx. These areas have also been associated with increased poverty. In Kings County itself, the data that you see is the amount of discharges we have seen in 2017 to 2024. And as you can see, there are thousands of patients in Kings County that are being discharged over the years from stroke. So, being a physical therapist, it is very important for me to know why should one exercise, and there's a lot of evidence to that. One key thing that is important for everybody is that we need to begin early. The key evidence for having these exercises is coming from the American Heart Association. There are common exercise recommendations that are being given by the AHA, that is aerobic exercises, strength exercises, flexibility exercises, and neuromuscular exercises, which are nothing but the balance and gait training exercises. The recommendations for aerobic exercises is to work out at 55% to 80% of your heart rate maximum, and the rate of perceived exertion should be between 11 to 14. One must remember that whenever you want to start exercises, you must consult with your MD or also with your physical therapist when you're planning to do exercises at a very high intensity, like 80% of your maximum heart rate. Why do we want to do it at a higher intensity? There's, again, a lot of evidence to that. As you can see, that whenever patients are being treated with higher intensities, there are greater amounts of improvements in cardiovascular health compared to lower intensities. And the intensity doesn't depend on what the person is made to do. It actually depends upon what the person actually can do. So if you've never worked out before and now you want to run a marathon, that might be too intense for you. So the intensity really depends upon your baseline fitness level, your neurologic involvement, how bad the stroke was, your cardiac status, presence of any other comorbidities like diabetes, high blood pressure, and how stable one is. And what are the goals of the program? Whatever happens, the screening of the patient is a must. The patient should be medically stable before the exercises begin. Now, the common question, what one can think of is like, when do we really start these exercises in people who have a stroke? There has been a lot of evidence and more research is going on. How early can we actually start the exercises? Very early mobilization, which means that the patient is made to move around even less than 24 hours after the stroke has happened. There was a study that was a Cochrane systematic review with more than 2,000 patients. It was done in 2018 by Langhorne et al. What was found that it is beneficial. However, we have less evidence how it works. So it does reduce the length of stay by 1 day. You do have higher activities of living scores. And those parameters, though present, don't really show us significant improvement compared to people who might be doing mobilization after 24 hours. There's an additional risk. Intensive mobilization may carry an increased risk for some of these patients, and actually the death could be at 3 months. So we want to be very careful when we actually want to begin our exercises. So we still want to think about, should we begin within 24 hours after stroke? Should we begin after 24 hours? So more research needs to be done. You do need to identify safe optimal dose and the type of exercises and the timing of this early mobilization post-stroke. Current recommendation is we should begin it at least after 24 hours of the patient experiencing stroke. Now, how do we predict the outcome? Oftentimes, one goes through a stroke, and the first question most people tend to ask is, will I walk? Will I get back to what I'm going to do? So there is some data which can help us predict how the patient would do once someone has had a stroke. There are various factors that influence outcome, and that amongst those, the first one is the stroke severity, your functional ability at the time of admission. It's usually calculated through the FIM scores, and it is noted that a FIM score of more than 60 is associated with a higher likelihood of functional improvement. And then there are other factors that play a big role in someone's outcomes. That is their age, gender, other comorbidities. How much cognitive dysfunction has this person had, either before or after the stroke? What is your social support system? People who are living alone versus people who have some family to support them usually tend to fare better than those who live alone. And then, of course, how were they doing before the stroke actually happened? So the healthier you are, the lower the risk that you will have worse outcomes.